Welcome to the Psychology and Physical Training channel, The Invisible Challenges. How often do we ponder the unique challenges faced by differently abled individuals? This question might not cross our minds regularly, but it's a crucial one. Our focus today is on the intersection of psychology and physical disability, a topic often overlooked in mainstream discussions. We'll delve into the world of psychological counseling, specifically tailored for those who are differently abled. Imagine navigating the world with a physical disability and simultaneously grappling with mental health issues. The challenges can be immense and multifaceted. That's why psychological support is not just a luxury, it's a necessity. Throughout this video, we'll explore a range of case studies, highlighting the complexities and nuances of this topic. We'll discuss the need for psychological counseling, the techniques used, rehabilitation management for the mentally disabled, and the rights of disabled individuals. Understanding these challenges is the first step towards providing effective psychological support. And that's what we're aiming to achieve here today. The need for psychological counseling. Why does a differently abled individual require psychological counseling? That's the question we are exploring today. The physical challenges faced by differently abled individuals are apparent and often well acknowledged. However, the emotional and psychological struggles that accompany these physical disabilities are less visible and sometimes overlooked. Imagine the world of a person with a physical disability. Simple tasks like getting dressed, taking a shower, or even walking can become daily challenges. This constant struggle can lead to feelings of frustration, helplessness, and isolation. Over time, these feelings can morph into more serious mental health issues such as depression, anxiety, and low self-esteem. Let's take the case of Jane, a young woman with a spinal cord injury. Jane was once an active individual who enjoyed hiking and swimming. After her injury, she found herself bound to a wheelchair, unable to participate in the activities she once loved. She started to feel isolated and began withdrawing from her friends and family. It was only when she sought psychological counseling that she began to regain her sense of self and find new ways to engage with the world. Then there's the case of Robert, a war veteran who lost his leg in combat. Robert was always a strong, self-reliant individual. His physical disability, however, made him feel vulnerable and dependent. He developed severe anxiety and had difficulty sleeping. Psychological counseling helped Robert manage his anxiety and develop coping strategies to regain his independence. These are just two examples of how psychological counseling can make a significant difference in the lives of differently abled individuals. It can help them navigate their emotional struggles, foster resilience, and reclaim their sense of self. It can provide them with the tools to adjust to their new reality and find joy and fulfillment in their lives. When we understand the emotional and psychological struggles that accompany physical disabilities, we realize that psychological counseling is not a luxury for differently abled individuals. It's a necessity. It's a lifeline that can help them navigate their unique challenges and live fulfilling lives. These cases make it clear that psychological support is not just desirable, but often essential. Counseling techniques for differently abled individuals. So, how can a psychologist provide effective counseling to differently abled individuals? Indeed, that's a question that's crucial to understanding the dynamics of psychological counseling. The key is to adapt and tailor counseling techniques to better meet the unique needs of differently abled individuals. Now let's delve into a couple of these techniques and see how they can be adjusted effectively. First up, we have cognitive behavioral therapy, often referred to as CBT. It's a form of therapy that helps individuals change their thought patterns to improve their feelings and behaviors. For differently abled individuals, this can be especially effective. For instance, a person with a physical disability might struggle with feelings of inadequacy or frustration. Through CBT, they're guided to challenge these thoughts, helping them to develop a healthier and more positive self-perception. Then we have humanistic therapy, a technique that emphasizes the individual's innate potential and the importance of self-exploration. This kind of therapy can be incredibly empowering for differently abled individuals. It encourages them to embrace their unique experiences and to view themselves as more than their disabilities. Furthermore, it fosters a sense of autonomy, helping them to realize that they're capable of making decisions and influencing their own lives. It's worth noting that while these techniques can be effective, it's essential that they're adapted to suit each individual's unique situation. This could mean using more visual methods in CBT for those with hearing impairments, or incorporating tactile activities in humanistic therapy for those with visual impairments. The key is flexibility and adaptability, ensuring each person receives the most beneficial form of therapy for their specific needs. In addition to these techniques, a counselor must also foster a supportive and understanding environment. This means acknowledging and validating the individual's experiences, while also challenging any negative self-perceptions. It's a delicate balance, but with empathy and patience, it's certainly achievable. With the right techniques, psychologists can make a significant difference in the lives of differently abled individuals. This isn't just a hopeful statement, it's a reality. By tailoring therapies and creating supportive environments, we can help differently abled individuals lead happier, more fulfilled lives. Rehabilitation management for mentally disabled. What about those who are both physically and mentally disabled? How can they be helped? This is where rehabilitation management comes into play. Rehabilitation management is a multidisciplinary approach that seeks to empower individuals with disabilities to achieve their maximum potential. Now, imagine the challenges faced by someone who is both physically and mentally disabled. The physical disability might limit their mobility or their ability to perform daily tasks, while the mental disability could affect their ability to communicate, understand, and process information. This combination of disabilities can make it incredibly difficult for these individuals to integrate into society and live fulfilling lives. So, how can we address this? Here's where a few case studies can provide some illumination. Let's consider the case of a 25-year-old woman with cerebral palsy and a mild intellectual disability. By utilizing a personalized combination of physical therapy, occupational therapy, speech therapy, and cognitive behavioral therapy, she was able to improve her mobility, learn essential life skills, enhance her communication abilities, and manage her emotions in a healthier way. Or take the case of a 40-year-old man with a spinal cord injury and post-traumatic stress disorder. With the help of a comprehensive rehabilitation management plan that included physical therapy, trauma-focused cognitive behavioral therapy, and vocational rehabilitation, he was able to regain some of his physical independence and learn to cope with his traumatic memories. He even found a job that accommodated his physical limitations and gave him a sense of purpose. These examples showcase the power of comprehensive rehabilitation management. It's not just about treating the symptoms, it's about addressing the whole person. This involves understanding their unique challenges, setting realistic goals, and providing the necessary support to help them achieve these goals. And let's not forget the importance of social integration. Community-based rehabilitation programs can help these individuals form meaningful social connections, participate in community activities, and feel more accepted and valued in society. Through rehabilitation management, we can help these individuals lead more fulfilling lives. It's a challenging journey, no doubt, but with the right support and resources, it's a journey that can lead to incredible growth and transformation. Rights of disabled individuals. In addition to psychological support, what other rights do differently abled individuals have? Well, it's important to note that these rights extend beyond the mental health sphere, encompassing a broad range of legal protections. The United Nations Convention on the Rights of Persons with Disabilities, for example, ensures the right to equality and non-discrimination. It mandates that all individuals, regardless of their physical or mental abilities, have equal access to education, healthcare, and employment. In the realm of psychological health, differently abled individuals also have the right to receive counseling tailored to their unique needs. This not only means access to services, but also the assurance that these services are respectful, inclusive, and sensitive to the person's experiences and challenges. But rights on paper are not enough. They must be enforced and respected in practice. That's where we all come in. Understanding and advocating for these rights is crucial for ensuring the well-being of differently abled individuals. The power of understanding. What can we take away from all this? As we reach the close of our discussion, let's revisit the key points and recognized the significance of psychological counseling for differently abled individuals. Our journey began with acknowledging the invisible challenges, the unseen battles faced by these individuals daily. It was then that we realized the pressing need for psychological counseling, not as a luxury, but a necessity. We dove into the various counseling techniques tailored for the differently abled, understanding that a one-size-fits-all approach simply doesn't work. We also explored the realm of rehabilitation management for the mentally disabled, highlighting the role of customized programs in their journey of improvement. Finally, we stressed the importance of acknowledging and safeguarding the rights of disabled individuals, ensuring their dignity and independence. It all boils down to one thing: understanding their unique struggles, their unique strengths. With understanding and support, we can help differently abled individuals overcome their unique challenges and lead fulfilling lives. And if you like this video, do not forget to subscribe and follow the Psychology and Physical Training channel for more videos. Thank you for watching.